So we're gonna numb you with a little bit of lidocaine here. Pinch and burn. Just numbing that site that we're gonna go in. So we've marked our entry point here, targeting that under eye. Okay, so you should feel like pressure. This shouldn't be sharp pain. You feel pretty numb there?
Yeah.
Okay. I'm just gonna create my entry point. So this is the entry point that I'm gonna use for my cannula. And we are using a heavier product and placing deep to try and give her some support in the under eye. This is a cannula that we're using, no sharp needles here. Okay, let me know if you're uncomfortable at all, okay? It will feel sort of like creepy crawly.
Yeah.
But I don't expect any like pains. Doing okay so far?
Yeah.
Okay. Still doing okay?
Mm-hmm.
Okay. Okay, so I'm aspirating prior to injecting.
Ooh.
Sorry, sort of a funny feeling. Okay, now you'll feel some pressure, okay?
Okay.
So I'm injecting retrograde and delivering my product in this area. And I'll probably go back in a couple of times and just give her some threads. Again, always retrograde injections.
Oh, that feels right.
Pain or just feels funny?
It just felt like a lot of pressure when you push down.
Okay. How is that now, okay?
Yeah, still like a little pressure, but not bad.
Okay. So I've advanced my cannula again, so I'm going to aspirate again. So it's basically just about placing that product really deep to try and give her a little bit more of deep support in the under eye using that cannula. Little bit of massage to make sure that it's nice and smooth, and then you go back in just as many times as you need. I discussed with the patient prior to treatment the need for just really careful treatment of this area. It's a fairly finicky area and we don't want to overcorrect because it tends to pull some water. And so I would rather undercorrect and allow a little bit of room for some water pull and see her back in a couple of weeks. If at that point she needs a little bit more, then we can always give her more. But the last thing I want to do today would be treating her to a full correction. Then she pulls water and then she looks overfilled. This is an area that can be very easily overfilled and we definitely don't want to do that today. Open your eyes for me. Good. Relax, you can close them if you're comfortable. Okay, aspirating again. Every time you go in or redirect your instrument, you should always aspirate prior to product placement. I just went in and put a little bit more in, and then I'm probably going to move to the other side. And then we'll see her back in 2 weeks and decide, you know, if it looks good once she's pulled that water or if she needs a little bit more. Okay. All right, so we're gonna go ahead and anesthetize our entry point here. So I just have a little bit of 2% lidocaine and I'm numbing that site. Pinch and burn. And that way when we go in with our needle to create our entry, she'll be pretty numb.
Oh.
You okay?
Yeah.
Does that feel sharp or dull?
Just that. It felt fine.
Feels okay? Okay.
Yeah.
Okay, so I've used my needle there just to create a very tiny hole, and I'm now going to use my cannula. This is a 25 by 50 millimeter cannula. Fully blunt. We like to use cannulas in the under eye because it's just a very vascular area, so avoiding the use of a needle is safer and also just allows for less bruising, swelling, things like that. Okay?
Yeah, I felt a pinch there.
Can you turn your head towards me just slightly? Thank you. Comfortable or no?
It's a little, like, feels like it's pinching.
Okay. Good pressure.
Okay.
Alrighty, so now we are performing essentially the same technique and procedure on the left side that we used on the right. You can see that I've already accessed my entry point with my cannula, and I'm placing my material in a retrograde fashion after aspirating, of course. Always want to ensure that we aspirate anytime we redirect our cannula. And you can see I'm going sort of in and out, fanning the material in that tear trough area to make sure that we're giving her the support that she needs. Again, this is that heavy filler, so it's really giving her that deep support to help support the tear trough area. And I've placed a couple of threads of material, and now I'm just going to massage to make sure there's a really nice smooth transition between the cheek and the under eye. Okay, so that's probably all we'll do today. For today, we did a half a syringe between the two sides, so about a quarter of a syringe on either side, and then we'll give her 2 weeks, let all the swelling completely come down. That'll give her body some time to absorb some water, and then we'll see her back at that point and decide whether or not she needs any more, or whether she's happy with the results. Thanks for watching.